This topic is care of special populations who are pregnant. Special populations who are at an increased risk for poor outcomes associated with pregnancy include adolescents, clients who identify as lesbian, gay, bisexual, transgender, queer questioning, intersex, asexual, and all other sexual or gender identities that are not mentioned in the LGBTQIA acronym, and clients with intellectual disabilities. We will discuss each of these populations in more detail. Adolescence begins at the onset of puberty and continues until physical growth is complete. Adolescent clients are at an increased risk during pregnancy because of behavioral, psychosocial, and socioeconomic factors. Behavioral considerations include a lack of contraceptive use, decreased insight into consequences, and peer pressure to be sexually active. Psychosocial considerations include family dysfunction, history of abuse or neglect, and lower self esteem. And socioeconomic considerations include clients who lack social connections and resources. When caring for adolescent clients who are pregnant or at risk for becoming pregnant, the nurse should use a non judgmental approach to establish a trusting relationship. Prioritize the concerns and needs of the client and involve their caregivers as appropriate. There are many social implications associated with pregnancy in adolescence, and the client may feel nervous about others learning about the pregnancy. So, the nurse should reassure them that the nurse client relationship is confidential. And the nurse should discuss all options available to the client, including adoption, abortion, and resources that are available if they decide to continue the pregnancy, like social services or food banks. We will also discuss potential parental responses to the pregnancy and the importance of prenatal care throughout the pregnancy. And for these clients, we will encourage counseling to help them process the complex feelings and changes associated with pregnancy during adolescence. When caring for a client who is pregnant and identifies as LGBTQIA, the nurse should provide a welcoming environment. This can be done by providing inclusive intake forms with gender affirming and gender neutral language. If artwork or pictures are present in the environment, then they should include photos of diverse families. And non discrimination policies should be posted throughout the environment. When interacting with these clients, the nurse should avoid generalizing or stereotyping and asking questions based on curiosity. Instead, the nurse should use the client's preferred pronouns and non gendered words. For instance, saying the client who is pregnant. These clients may experience gender dysphoria if they need to stop gender transitioning treatment because of their pregnancy, so the nurse should offer support. And the nurse should offer alternative options for postpartum feedings that align with the client's desires, such as chest feeding. When caring for clients with intellectual disabilities, the nurse should understand their risk factors, including the risk for unplanned pregnancy and delayed prenatal care. Evaluate the client's level of understanding of the pregnancy and provide simple, straightforward information to help the client understand what you are teaching them. Use communication aids like visual or audio recordings and printed materials that may be beneficial. Provide family-centered care to ensure that the client's family or caregiver understands the teaching and will be able to help the client throughout the pregnancy. Allow extra time for appointments so the client doesn't feel rushed and has time to understand what you're telling them. Encourage the client to attend group prenatal classes if they're able to, and lastly, evaluate the client's support system and ensure they have access to the care they need.